And so for baby Carla...
Can I record it for a little bit?
Yeah, sure.
Thank
That's
you.
okay. Yeah, so for baby Carla, they passed their tests. They passed their car seat test because they're small, so they need to make sure that they're getting enough oxygen while in the chair. They passed their hearing test. The other things that was done, they did the little heel prick on baby. They sent that out to the lab, and then for they just check for some of the genetic disorders. And so if you don't hear a call, that's a good sign.
Okay.
And then they checked baby's heart, and that was baby A passed the heart test, meaning blood flow is going to the upper body and lower body at good rates, so flowing all the way around. The only other things that I was checking was to see how baby Carla was feeding. How was feeding for baby?
They are both taking and breastfeeding and giving the bottle.
Okay, yeah.
The formula a little bit at the end.
Yeah.
Basically when they when they don't wanna like anymore take the breast anymore, then I'll give the formula.
Okay. Yeah. It looks like Carla has been doing a little bit better in terms of keeping their weight.
Yes.
They're down by 6.4%, meaning every baby is born at a certain weight, and then the weight goes down, and then it should come up by the second week. And then the range that we look for is around 10% of weight loss is okay. And so we just try and encourage feeding if it's a little bit faster. And so yeah, exactly what you're doing is good. Offering breast milk first and then offering the formula afterwards, just so that they can make sure they get enough feed. And then for baby B, what was her name again?
Zoe.
Zoe. So for baby Zoe, similar thing, they passed all their tests. But the one thing that I was seeing is baby Zoe, their weight went down a little to 10%. And so that's the range that we're looking, just to make sure that baby doesn't lose more than that. And so the big things that we're looking for is just kind of reminding baby to feed a little bit more often. So instead of like every 3 hours, which is our normal, you can try moving it every 2 hours for baby. And you can kind of do both babies at the same time for every 2 hours, just so that you don't have to stagger. And then just kind of offering the formula a little bit after every feed for baby, because they went down to 10%, and we want to make sure that they come back up. So those are big things for them. I just wanted to kind of update you on what happened with the babies so far. But, do you have any questions?
That thickness of the skin is not going to be tested again, right? The yellow skin.
They're going to test the skin one first.
Yes.
Yeah, so they're going to test that soon, because we just want to make sure we have one for today. Because yesterday they tested the skin. It was a little high, so they tested the one in the blood, which they do with a little heel prick for that. And then that one was in the middle risk, and so that just means we'll follow and check their skin within a few hours or so. And so that's what we're trying to do, is just check their skin again and see how it is. And so the thing for that number, it's called bilirubin, and the bilirubin is the jaundice number, or the yellow baby number. And so for that, what jaundice is our blood, essentially it recycles. And so as adults, our livers are the ones that recycle the blood. And since we're adults, our livers are mature, and so they can recycle it fast, and we pee it all out. But for babies, since they're so young, their liver is still immature, or it's young, and because of that, it's slower at recycling. And so in the beginning, the first 4 days of life is when that number peaks the highest, and that's why we always check every day, or we've been checking every day with baby for their jaundice or their bilirubin level, and then that's what we're going to check for today. And so that's the main thing. Sometimes it can stick in their blood for a little bit longer, and if it stays in for a little bit too long, or if that number is too high, what we do is we just help out baby, and we have like lights, essentially, kind of like a suntan essentially, and it helps turn that material in baby's blood to something that's easier to pee out. But what's encouraging is babies, both of them have been having wet diapers,
Yes.
which is I've seen 2 for both babies in the past 24 hours.
Mhm.
And when they're 2 days old, we want to see at least 2 wet diapers, which they have had. And that's the way they get this material out of their body, is just peeing it out. So just the main things we're checking on for baby is making sure that they're feeding enough so they can pee out more, and then they can gain their weight back.
I
So
see.
that's the things that we'll be looking for, and
Okay.
we'll, as soon as those numbers come back, and we can interpret those numbers for you.
Okay. great.
Excellent.
But I'll be around, so if you have any other questions.
Thank you very much.
Thank you, doctor.
Okay.
You
Yeah, no worries.
My name's Samantha. I'm gonna be your nurse.
Hi.
Hi, Samantha.
Hi, Samantha. Can I record you a little bit?
Sure.
Thanks.
I'm just gonna put this on her foot here.
You got double the fun in here, huh?
Yeah.
Oh my gosh, you put little letters on them?
I have to stay with the camera towards you, Samantha, because there are pervs out there that can't they can see this part and get without getting excited, which is
Oh my gosh.
not right. But
Are they
Solange is
identical?
No.
No?
breastfeeding Carla a little bit, so
They're so adorable.